I am Ruth McEwen, Advisory Council member serving on the Northwest Senior and Disability Services Advisory Councils. I want to welcome candidates, incumbents, and Advisory Council members to the 2024 Candidate Interview Forum. This program features candidates and incumbents from districts serving Clatsop, Marion, Polk, Tillamook, and Yamhill counties, and is sponsored by our Senior Advisory Council and our Disability Services Advisory Council. Northwest Senior and Disability Service is a local governmental organization that provides Medicaid, Oregon Project Independence, Older Americans Act, and grant-funded programs. The mission of the Northwest Senior and Disability Service is to promote dignity, independence, and health, honor choice, and empower people. The assistance and support we provide to consumers includes information, assistance, in-home and community-based services, financial and medical help, meal site and home-delivered meals, options counseling, adult protective services, Medicare counseling, and peer mentoring, money management, as well as health and wellness programs. Because of the number of state legislative districts that our service area covers, we have invited a large number of candidates to our candidate interviews. Each candidate has been given information on the format used in these interviews. Each candidate will be introduced by a member from the advisory councils, and then candidates will have the opportunity to answer questions which will be timed. We thank these candidates for their willingness to share their views about services for Oregon seniors and people with disability.
Hi, my name is Stephen Meneses. I'm a member of the Disability Services Advisory Council and Northwest Senior Disability Services. Today I am interviewing Virginia Stapleton. She is a Democratic candidate for Oregon House District 21. We'll be asking candidate Stapleton questions related to seniors and people with disabilities. Welcome, candidate Stapleton. Thank you for sharing your time with us.
Thank you for having me.
You're very welcome. We have a series of questions we'll be asking. Tell us about your platform and experience that would encourage a senior and person with disabilities to vote for you.
Yes. Well, again, thank you so much for having me. And like you mentioned, my name is Virginia Stapleton, running for House District 21. I am a lifelong resident here of the Salem-Keizer area and have a really deep knowledge of the challenges that our community faces and the amazing attributes that also are here and that make this a wonderful place to live. I've been a city councilor for 3.5 years now, almost 4, and so really have a deep understanding of some of the challenges that folks are facing day to day. And what I'm hearing the most on the doors is that housing affordability is the number one concern that people have, and really proud of the work that we've done on city council to address that crisis, adding over 1,000 shelter beds and working hard to increase our supply of housing across the spectrum, from apartments to ADUs, accessory dwelling units, all the way up to single family housing, so that we can help drive down the cost of housing for everybody. Especially for seniors who are on a fixed income. This is a concern I hear a lot about, and I really want to take time to address that in a serious way. Next up is that I really feel that there is a strong need for mental and behavioral healthcare access for all here in Salem-Keizer and across the state. Oregon is really lacking in that area, and so trying to address that shortage of providers and the access that so many struggle to gain for that really vital care that many people have and need. And then lastly, of course, because of my time on city council, I have a real deep understanding and knowledge of the crisis that's hitting many cities across Oregon, but also in our school districts, and because of measures 5 and 50 and the stress that that's putting on their finances. So trying to find real solutions to that problem so that we can have quality education for our kids, and that people can have the services they deserve and desire across their city. Things like police, fire, EMS, library, parks, Center 50 Plus, all of those things that really make life enjoyable here in Salem. So that's really the three things that I'm focusing mainly on. Of course, there's a million other things that I would love to address, but when we're asked to come up with a few things, those definitely rise to the top for me.
Thank you. How would you prioritize state funding, including funding that is matched with federal funds, such as Medicaid, for services to an ever-expanding number of seniors and people with disabilities?
Yeah, this is a great question. And again, I have to start off with and say that politics is really about relationships. And over my course of time here on the city council, I spent a lot of time investing in those relationships with not only my fellow councilors and the mayor, but county commissioners on both sides of the river, all kinds of folks from neighboring towns, the school district, et cetera, the transit district, even. And so, really working on those relationships that bring a collaborative feel to any of the challenges that we're faced with as a community, that really helps us present a stronger case to our federal delegation. And it has worked so far, especially over the past 3.5 years on council. We've been able to really advocate strongly at the federal level for investments here in Oregon and in the Valley to address many of the concerns that we have, not only in our infrastructure, but our housing as well. So continuing those relationships, but also making sure that the priorities are correct when it comes time to spend the money. So making sure that we are working hard to meet the needs of the most vulnerable in our community. That's going to be a priority for me. And because of those higher costs that people are faced with right now, it's really impacting families, especially seniors. And we really need to invest in ways that we can find affordable housing and healthcare that's accessible to all people. And seniors deserve to be able to retire with dignity and enjoy those golden years. And the community needs to come around and support that. So at the State House, I will fight every day to ensure that we are supporting seniors and families to maximize our resources here locally. And our communities need volunteer leadership who is going to willing to advocate on behalf of our residents, and I'm willing to do just that.
Wow. Thank you for your response. It is becoming increasingly challenging for seniors and people with disabilities to obtain housing due to constantly rising housing costs and an insufficient supply of disability accessible housing. What will you do on a state level to prioritize affordable, accessible housing?
Yeah, this is a great question. I want to really focus in on the fact that we need to do more for accessible dwelling units across the state, really across the nation. But I will focus in here on Oregon since that's where I plan on serving. But we need to do more. I hear about this constantly from folks in the community. And, it's not something that I really understood until I was out in the community and talking to folks. And they've really opened my eyes to see the disparity, to see the need. And digging into that a little bit on a city council level, I've been able to uncover some of the needs that we have, that the areas in which we're lacking here locally, and that we really need to address this at a statewide level. So I do want to tell you a story, though, about a person I met when I was out knocking doors in Kaiser. I was at an apartment complex, and I was on a second story apartment when I knocked on a door, and a person opened the door, and they happened to be in a wheelchair. But there was no elevator around. It was just stairs up to their apartment. And I spent a lot of time with this individual talking with them, and they were really in a desperate state. And what had happened to them was not planned. And they had lived in this apartment for years and years and enjoyed that lower cost of rent. And they had been let go from their job because of this medical situation that came up. And they were really in a dire place, only a few months away from being unhoused. And that really struck me. And I came home and called my campaign manager and said, I just had one of those moments as a politician that you will carry with you the rest of your life of service. Something that I will always be able to pull up and remember. It was really a moving interaction with this individual, but I saw so many holes and gaps in our system of care for this individual, as well as in the housing aspect of that. And so that really drove it home for me the need to ensure adequate care for folks, but then also to address this issue of accessibility within our dwelling units and making sure that folks who are, put into that position where they are find themselves disabled, that they then have access to and protections to where they can get the housing that they need instead of being stuck in this position that really was not something that he could endure much longer. So um, I really see the need. It's become very clear to me on the campaign trail, and I'm excited to get to the State House and really make some good policy around some of these lived experiences that I've seen and understood from folks.
Thank you so much. What would you support on a state level to prioritize access to healthy and nutritious food for seniors and people with disabilities?
Yeah. So I want to share with you a little bit of a story. I grew up with a lot of poverty in my life. I come from a really big family of 11 brothers and sisters. And so, food was not always a guarantee. And we were one of those kids who had the free meals. And back then, stood out, right? It was definitely something that there was some stigma around. And so I tell this story because, now we have schools that qualify as a whole for free and reduced lunches, and everybody in that school gets those. And so the stigma has really been released from that. And for me, I really feel strongly about releasing that stigma. I think, food is something that we all desperately need, of course, to survive. And the stigma should be removed entirely from folks who don't have enough to provide for themselves. And I want to make sure that as politicians and as government, that we are making sure that the information about these services is clearly communicated in a way that is accessible for so many. I know that there's a digital divide, and I know that there is a divide as far as how we access information. So being mindful of that. But this last session, there was an ask from the Oregon Food Bank for $10 million in order to feed our community in need. And they did not receive any of that money. But we did fund over $17 million for baseball across the state. And so I
Mm,
see that really discrepancy in our values. What are we here to provide? And I want to make sure that I'm there fighting for, the basic needs of all of these folks who are the most vulnerable in our community, really fighting for that because I see that that is such a strong need and a basic human right to access that food. So really excited to get to work on that issue.
thank you. The last question. What would you do to address the behavioral health needs for older adults and people with disabilities?
Yeah, this is another great question here, and thank you so much for asking. Um, as a city councilor, I saw so much need here in our community, and so many folks who were ill-equipped to respond to that need. I saw firefighters and police officers and librarians and park staff trying to respond to mental and behavioral health crises on our streets and in the parks and services, located in our libraries or our Center 50 Plus. And they really struggled. And that's because they don't have the training they need in order to respond. And I've seen a desperate need across the state. And this is because we don't have enough folks who are practicing here. And we don't have enough people in the education pipeline for the need that we have currently. So as somebody who wants to go to the Capitol and work hard for my community, really seeing to that need of folks in our education pipeline, we need to make this accessible and really advocate for folks to take on this really amazing healthcare opportunity to provide for our folks. I myself, I have a child who struggles with sensory processing disorder. And so we had the great blessing of being able to access behavioral health care needs for our family. And it literally saved our family. And so I understand the value that these folks provide for our community. And I want to make sure that everybody has access to that when it's needed. And I'm willing to do just that. We need leaders who have had lived experiences, not only from poverty and trauma and mental and behavioral health care, but also this housing insecurity and food insecurity. Those lived experiences really matter when you're making policy, and I'm really excited to be able to take all of those lived experiences with me to the Capitol, be able to make good policy for our community that's really going to make a difference.
Thank you for your thoughtful responses. We've been visiting today with candidate Virginia Stapleton, a Democratic candidate for Oregon House District 21. Thank you, candidate Stapleton, for joining us today in the interview.
Thank you so much for having me. It was a pleasure.
Very welcome.
I want to thank the candidates on behalf of the members of the Senior Advisory Council and Disability Service Advisory Council of Northwest Senior and Disability Services for attending our candidate interviews. We hope the information that has been provided will help you make informed choices when you vote. The opinions expressed here are not endorsed by Northwest Senior and Disability Services. For more information or to get connected to services provided by Northwest Senior and Disability Services, call 1-866-206-4799. The advisory councils for Northwest Senior and Disability Services would like to thank Capital Community Media for their production of the forum. Thank you for watching.